The same way you hear ladies and men saying, he comes quickly, I want him to last longer. That is the same way you hear men and women saying, oh, my man takes a longer time to come, or he doesn't even come at all. So in this particular video, I'm going to be explaining three types of ejaculation so you stay informed. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be explaining the three types of ejaculation, what causes them, and what you should do. All this information I shared we are gotten from nhs.uk website. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. All right, welcome back. So the first type of ejaculation I would like to share with you is premature ejaculation. Premature ejaculation is a common type of ejaculatory problem. It happens when a man ejaculates sooner than his or her partner or his partner wants it during arousal. So occasional premature ejaculation, it's okay because you can deal with it and it's something for you not to be worried about. But when it occurs frequently and you are worried and perturbed about it, it's advisable you speak with your GP and get useful help. There are different causes of a premature ejaculation. It could be psychological and it could be physical causes. So let's talk about the physical cause of premature ejaculation. The first one I have to share with you is prostate issues. So if you're having issues with the prostate gland, it could be prostatitis, it could be cancer of the prostate, that can cause premature ejaculation. Then the second one I have to share with you is thyroid issues. There could be underactivity of the thyroid gland or overactivity of the thyroid gland. So that can cause what? That can cause ejaculatory problem. So the third one I want to share with you is the use of recreational drugs. So if you are a man and you use recreational drugs, it's advisable you stop it because that can also affect your ejaculation. Now let's talk about the psychological causes. One of the psychological causes is depression. When a man is depressed, his sexual performance is also affected. Then the second one is stress. Like I always tell you, stress is generally not good for your body. It's not good for your overall health. So if you are stressed as a man, it's advisable you look for methods or mechanism that will help you to manage your stress effectively well. Then the third one I have to share with you is relationship problem. If you're having a relationship problem with your partner, that can affect the sexual performance of the man. And another one I have to share with you, and I think it's very important, is anxiety. Having this anxiety of having sex, you are anxious of having sex, especially if you are doing it for the first time or you are you are having a new sex partner, that can go a long way to affect your sexual performance and cause premature ejaculation. I want to also let you know that it is possible for a man to be experiencing premature ejaculation since when he started having sex, since when he was sexually active. And one of these reasons is conditioning. Yes, what do I mean by conditioning? For example, if a teenager conditions himself to ejaculate quickly to avoid being caught masturbating, it may later be difficult to break that habit. For example, a teenager during the young age was masturbating and like, oh, I have to do it fast. I have to come quickly before someone gets caught, before I get caught. So every time he masturbates, he quickly come quickly. That can also affect his mindset in such a way that premature ejaculation steps in. So that's something we should take note of. And another thing I would like to share with you is a previous traumatic sexual experience, like being caught masturbating or sexual abuse, like someone that was sexually abused at a tender age. That can also cause premature ejaculation in the long run. Then another is a strict upbringing and belief about sex. So these are the things that can likely cause premature ejaculation. When it comes to what to do, if it is something that is bothering you, what I advise at this particular moment is to speak with your general practitioner, your doctor, your healthcare provider, so that they give you useful advice and, if necessary, some medications, some antidepressants that can help you and overall health and well-being. So that is what I have to say in regards to the first one, which is premature ejaculation. Then that takes me to the second one, which is delayed ejaculation. Delayed ejaculation is also known as male orgasmic disorder and is classified as either a man is experiencing significant delay during ejaculation, like before he ejaculates, it takes time during sex for this man to ejaculate, or this man wants to ejaculate but he cannot, even after spending longer duration during sexual intercourse. You can see the difference between delayed ejaculation and premature ejaculation. Same way you have people battling with premature ejaculation, that is the same way you have people battling with delayed ejaculation. In terms of delayed ejaculation, it can be as a result of different causes. Like the premature, it could be physical and it could also be psychological. But first of all, let's talk about the physical causes of delayed ejaculation. So the first one I have to share with you is diabetes. Diabetes can cause it, spinal cord injuries, multiple sclerosis, surgery to the bladder or prostate gland, increasing in age. So these are the likely cause, the physical likely cause of what? Of delayed ejaculation. So now let's talk about the psychological causes of what? The psychological causes of delayed ejaculation. The first one I have to share with you is antidepressants. So if you are a man and you are on some antidepressant medication, that can cause what? Delayed ejaculation. Then the second one I have to share with you is antipsychotic medications. So if you are treating psychosis, you are on some antipsychotic medications, that can cause what? Delayed ejaculation. Then the last one I have to share with you is antihypertensive medication. So if you are a man and you are hypertensive, you are on the various classes of antihypertensive medication, that can also cause delayed ejaculation. Now the question is, what should I do? In terms of what you can do, the best advice I can give here is to speak with a sex therapy that can help with counseling and psychotherapy. So this is what I can give, because I am not an expert in this field. I'm just giving a general knowledge that's going to help you. So if you know of any sex therapy that can help out, you can visit them, and they tend to give you a lot of options that are going to make sex more enjoyable and pleasurable for you. Then that takes us to the type of ejaculation problem, and that is the retrograde ejaculation. Is this sounding strange and funny? I'm going to be explaining it. Just calm down. What is this retrograde ejaculation talking about? In terms of retrograde ejaculation, like I earlier said, it is rare, it is not common when compared to premature and delayed ejaculation. What happens in retrograde ejaculation is that during sexual intercourse, when it's time to ejaculate, this sperm goes to the bladder. Yes, where urine is being stored. Instead of it to come out through the urethra, the sperm goes to the bladder. And the signs and symptoms you see when it comes to retrograde ejaculation is that when the man ejaculates, a little amount of semen comes out, or there is no semen production during ejaculation. But this man fully knows to himself that, oh, I just ejaculated. But in all, it's either there is little ejaculation on the outside, or there is no ejaculation at all. And another sign to know that there could be a retrograde ejaculation is clouding urine. So if you are a man and your urine is cloudy, it could be as a result of retrograde ejaculation, because the sperm goes to the bladder and now the urine is coming out with the sperm. Generally, retrograde ejaculation does not pose a threat to your health, but it can cause infertility. Yes, retrograde ejaculation can cause infertility, especially for those that want to give birth to the children. You may want to ask, what is causing this retrograde ejaculation? You can see the way the bladder is located, the neck of the bladder, it has muscles around it that closes the neck, that makes it tight in such a way that the sperm does not go into the bladder. But in retrograde ejaculation, the bladder neck is opened. So when the sperm is coming out, it goes into the bladder, because the bladder neck is opened. So instead of it to come out through the urethra, it goes to the bladder. So that is one of the major cause of what? Of retrograde ejaculation. Then another cause is prostate gland surgery, bladder surgery, diabetes, multiple sclerosis, and a class of medicine known as alpha blocker, which are often used to treat high blood pressure. So these are the causes of retrograde ejaculation. What I would also advise is to speak with your doctor as soon as possible, especially if you are having clouding urine and you are battling with fertility. It's advisable you speak to your GP or your healthcare provider as soon as possible. So remember, it's not just premature ejaculation that is the only ejaculation problem. We have premature ejaculation, we have delayed ejaculation, and we have what we call the retrograde ejaculation. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Bye and see you in our next video.